And a fine good morning to everybody. Welcome to a happy Monday. I hope everyone's well, had a great weekend. We'll hopefully see a little bit of the rain stopping, and we'll get a couple of nice days this week, which will be nice. My plan was to eat an apple. So I don't know if anyone else used to grow up where they said, an apple a day keeps the doctor away and the dentist away. Well, now it's quite embarrassing because it's a big bite. But I hope my mother doesn't watch this because you're never meant to talk with your mouth full. What I wanted to talk about was the dental disease. We have 2 more weeks, 10 days, 11 days left of our dental program. We, both clinics ran a dental awareness program in the months of July and August. The aim is to bring attention back to preventative healthcare. Preventative healthcare is absolutely essential, and there's nothing more important than our pearly whites for health. Right next to the teeth are our gums, and our gums are, when they get inflamed, can carry bacteria from our mouth directly through our bloodstream. One of my senior colleagues, Richard Churcher, specialist at North Shore, actually ended up potentially with heart disease from dental disease. He went to the dentist and he ended up in hospital. And so it's really important that we all concentrate on dental health. Obviously, we go to the dentist, and we should be going every 6 months. We should be constantly brushing our teeth. Dogs and cats don't necessarily do that. Now, I've got my friend here, Troopy. Come here. I'm going to show you Troopy's mouth. Now, Troopy just turned 3, and as some of you saw the other day, poor Troopy, he's always involved. But I just want to show you something. So here's Troopy's teeth. And what you can see is beautiful, healthy pink gums. There's no extra line of gingivitis there. The teeth look good, okay? There's a very small amount of staining on his teeth. Now, when I ask people to show me the teeth, it's really important that you get all the way back, okay? So we can see the teeth all the way from the back. Super, super important, not just the front. And then we also want to have a look at his beautiful smile at the front here. Okay, hey, there he is. Okay, so they're pretty good teeth, no real problems. And I'm relatively lucky because people sort of say, why do some dogs have dental disease and others? And that's because of the nose. Okay, dogs that are squashed up in the face end up having, like a pair of damaged scissors, end up having broken, the teeth don't abrade. And dogs that have a really elongated nose, like a greyhound, also the teeth don't abrade. And so it's really important for a perfect scissor bite mouth that it's the right nose. And we've obviously bred different dogs for different reasons. And one of those, one of the complications of breeding different dogs is we lose the bite and therefore we have dental disease. So we've got 10 more days. I'm just going to briefly turn the phone over and I'm just going to show you a couple of things here. So what you can see, Troopy's teeth were pretty much grade 0, okay? There's no disease, no requirement for any treatment. Stage 1 disease, so this is what we're talking about. You can see the gums are starting to get pink. There's even down the bottom there a little bit of bleeding going on. Although this is what we call grade 1 dental disease, where there's a little bit of gingivitis, maybe the very start of some gum disease. If you look up here, you can just see just a little bit of erosion of gum disease there, and this is a little bit of bleeding down here that I was talking about. Now, if we move along to grade 2 dental disease, what you can see is actually a significant buildup of brown plaque and calculus. So plaque is bacteria. Bacteria then solidifies, and that bacteria that solidifies can cause this yellow discoloration here, okay? And then you start to see this real quite thickening of gum disease. Now, the problem with that is that is the beginning of irreversible dental disease. So if we have a look here, the dotted line is where the bone should be, and you can start to see these pockets of bone loss. And that's what happens when the bacteria start to crawl down into the gaps between the teeth, and they start to cause bone loss. And that's one of the things that we are doing for Dental Month is we're doing free or at least complimentary x-rays. Now, if we move along to grade 3 dental disease, what you can actually see is the gum is being significantly eroded, okay? And so what you're getting is these massive gaps, and because plaque is bacteria, the bacteria are colonizing and eroding into the tooth root. And what happens here is we actually get significant bone loss. Now, in stage 2 disease, if we slow that down and you brush on a regular basis, you should actually be able to get to control that and stop progression. But once we get to here, we're going to have irreversible bone loss. We're losing bone in between the teeth. Okay, these teeth are going to come out. We may be able to get them back to a position right now of cleanliness, but it is going to progress. And there's a very good chance if we take an x-ray of a tooth like this, we can actually end up removing it. And then finally here, we have a tooth root abscess. So this tooth is actually floating. The bone has been completely removed. This is stage 4 disease. The mouths look absolutely terrible. They generally smell really bad. And we have dental disease here. And when we actually have stage 3 and stage 4 dental disease, there's the potential of actually putting your pet at risk, because what's actually happening is that bacteria is next to bleeding blood vessels. That can then get spread throughout the body, and we can cause all sorts of problems. So, rules of dental disease: keep your mouth healthy. How to prevent it? Well, come in and let's have a consult first, and then we can talk about what stage you're at. And watch this space, because we're soon bringing in an AI program for this, so that you can get some staging at home, which will prevent that initial consult. And then the next step of that is let's clean them and then do the prevention. And like us, twice daily, no one really brushes their pet's teeth twice daily, so we implement a few rules. The Hills TD biscuits, T for Tom or T for Teeth diet is excellent. Follow it with including of some treats. Orovet, Veggie Dent, slightly less impressive is Greenies, and there's also a seaweed extract that you can use. And just on that, you can go to the pet shop and you can see 1 million different products that say dental prevention. Most of them are complete rubbish. Most of them are marketing. Remember, as I've said before, that we have no food standards in this country. As much as the Veterinary Association has petitioned the government, there are no food standards. We go on the American Food and Agricultural Organization's food standards for pets. So that's AFCO, AAFCO. But for dentistry in particular, there's something called the VOHC. The VOHC, the Veterinary Oral Health Council seal of approval. And the products that have VOHC approval in this country are the only ones we recommend. And so that is the Hills TD, the Veggie Dent, the Orovet, the Greenies do, but to get VOHC a seal, you need to actually submit research, and the Greenies aren't quite up to the other products that I've mentioned. Also, Royal Canin Dental has VOHC seal of approval, and so does the seaweed extract. So hopefully that all makes sense. If there's any questions, please contact us. Very, very happy to talk dental disease, which helps create, or at least not dental disease, but dental health prevention. So making the teeth healthier will help prolong your pet's life and make them have a happier and healthier life. So very happy to talk about it. Until the cows come home, have a wonderful day. Bye-bye now.